This episode is brought to you by ProMensal.
I wish I could say yes. Every doctor thinks that now. Every menopause society would agree that women should be offered HRT and that when it comes to at least hot flushes, it is the most effective form of management of those symptoms. But there is still a lack of teaching in this area, and it is a very big black hole in the knowledge of a lot of doctors.
Welcome to Thriving in Menopause. I'm Andrea Duval and I'm the editor of Prevention magazine. Today we're talking with Dr. Ginny Mansberg, the GP and author of the M Word. In our first episode, Ginny spoke about the physical changes that women go through during menopause. And in her practice, she's often asked, can I take a pill to make all my symptoms go away? So today, Ginny is going to be talking about the cures. We wanted to learn the latest scientific evidence around HRT and other treatments. Welcome back, Ginny. Now let's talk about HRT and the current thinking of it, because for a while there it was considered quite harmful, and I know that it's something that there's probably a lot of misinformation about. So where are we at now?
Well, it's back. It's making a comeback, but not everybody's on board. You know, it fell off a cliff overnight and got fully rejected and kicked to the curb, and now it's sort of clawing its way out of the gutter.
So why did it fall out of favour?
So there was a really huge study that came out in 2002, so that's a long time ago, and I need to explain the study, and it's not going to be too sciencey, but this will help explain why it all went so pear-shaped. So it was a fantastic study of 160,000 women. And the idea was we already knew from a heap of studies that women who took HRT had less heart disease, less Alzheimer's disease, and doctors kind of were thinking at that point, particularly in America, if you hit menopause, you go straight onto HRT and you stay on it for life. And they were using reasonably big doses at that point. And so this study was designed to, I guess, confirm that. So they recruited women who were older. And we're not talking about women who had hot flushes. They didn't even ask these women, do you have hot flushes or any symptoms of menopause? The average age of the women being recruited for this study was 63, but a quarter were over the age of 70 when they started HRT. And they used a form of HRT, quite a high dose, and in a chemical formulation that we don't use anymore. We've got better forms of it now. And what they looked at was they followed up these women, and all of a sudden they realised that if you had 10,000 women who took a placebo, you would find 30 of them developed breast cancer. If you took 10,000 women who took HRT, 38 got breast cancer, and that was quite a lot more. And so they urgently halted the study, but instead of saying, in this older group who have this particular form of HRT, who started at an average age of 63, there is an increased risk of breast cancer. They said HRT causes breast cancer, and overnight, 70% literally chucked their packets in the bin. And that has been really difficult to recover from, even though the scientists went back through that data, and when they just looked at the women who started taking it between the ages of 50 and 59, they had less deaths from what we call all-cause mortality. So from all causes, they had less cancer deaths, they had much less bowel cancer, much less heart disease, but the damage had been done, and the reputation of HRT literally fell in a toilet. And it wasn't just that people had heard this sort of vaguely bad thing. There are still black box warnings on all forms of HRT all over the world today by every government. There were lots of doctors who were sued where women blamed their breast cancer on their doctors and the drugs they were given. And most drug companies just went, you know what, we're not investing in women's health anymore. It's just not a good market to be in. And doctors said, I'm not prescribing that anymore. I don't want to be sued, which I don't blame them. I don't want to be sued either. And women said, I'm not taking that anymore because it's dangerous. And all of a sudden, women were told, if you have hot flushes, really suck it up, because why would you take a pill that's going to kill you?
So the formula that's now used for HRT is more sophisticated than the one that was even available at that time?
Yeah, look, interestingly enough, you can actually still get the components of that form of HRT. And I find it really interesting that it's still available on the market, just because why would you prescribe that when there are kind of, I guess, better forms out there these days? But now we have estrogen that you can get across the skin, which has certain advantages, particularly for women who suffer from migraine like you do. We don't tend to see migraine from HRT that goes across the skin. It can be better for mood problems. It's definitely better for in terms of that risk, of that very tiny risk of blood clots that comes from any form of estrogen, whether it's the being pregnant pregnant or going on the pill or having HRT, they're small risks, but they are definitely mitigated by having estrogen that goes across the skin. And now we have much better forms of progesterone as well, that when we look at long-term studies, they have very, very low rates of breast cancer. So we have these options now. But I have to say, it has taken drug companies an incredibly long time and a lot of steel in their guts to be able to do research into the menopause market, despite the fact that this is a condition that's going to affect 100% of women who live long enough to go through it, and that's 51% of the population in the world. It's kind of crazy because from a market perspective, it's a good bet.
Yeah, so the current thinking among doctors is generally that it's if you are exhibiting the symptoms of menopause, any of the, unpleasant side effects, you should take HRT.
I wish I could say yes. Every doctor thinks that now. We're all singing from the same hymn sheet. Every menopause society would agree that women should be offered HRT, and that when it comes to at least hot flushes, it is the most effective form of management of those symptoms. But there is still a lack of teaching in this area to doctors. You can graduate in any specialty, including being a gynecologist or an endocrinologist, and never look at menopause, certainly not from an HRT perspective. And it is a very big black hole in the knowledge of a lot of doctors. I wasn't taught anything about it in medical school, and even to become a GP, you could get through without any knowledge of this whatsoever. And I have countless girlfriends that were told, I won't prescribe that for you. If you want that, you're going to know you just go and see a gynecologist. Then they go and see a gynecologist and they're put on some form of HRT that I think, why would you be put on that? And one of the problems is that HRT prescribing is a bit more of an art than a straightforward algorithm. When it comes to computers replacing doctors, this will not be an area that this will happen. It is an art form. And if you get given the wrong form of HRT, it can be so off-putting that a lot of women will say, I tried HRT and it didn't work for me, but in fact, they just didn't get the right form. And so I think that while menopause societies are very strong, and in fact, they immediately around the world came out, as soon as this study came out, saying that is wrong. That is a wrong conclusion. That should never have been said. It's incorrect. And they've been pretty much the same thing from day dot. It is not necessarily seen that way by all doctors, because a lot of doctors are still tainted by the fear that surrounded this whole condition.
So when you say that it's an art form prescribing of it, are you meaning that depending on your symptoms, there are other particular kinds? So I guess if you have an experience with HRT and it's not working for you, not to throw the baby out with the bathwater and maybe talk to somebody else?
Well, look, if you're And I think doctors are more and more open-minded about this now. And if you go back to them and say, look, this form didn't work for me. I had, for example, breakthrough bleeding, or I got very painful breasts from it, or I felt a bit nauseous with it, because can be side effects with some forms of HRT that your doctor would go, oh, okay, I know what to do next. Let's try this. And it can take a little while to get it right, but I think it is worth pushing on, because most women who consider going on HRT are really not feeling awesome. And, we certainly have come a long way from doing what we did in the 90s in the United States, which was if you hit 50 and you're going through menopause, let's stick you on this stuff and let's give you this juice till the day you die. We certainly don't do that anymore. If you have no symptoms, why take any medication? But I think that if you want to take a medication, either because your bones are weak or because you have high risks of some other conditions, or you're not feeling well, then we want to make sure that we persist with it and get it right.
So there are a lot of women who, in spite of all of this, don't feel good about taking any kind of chemical or drug. Are there alternative treatments that are as good or that really work?
So the thing that I like about HRT in a way is that it kind of wraps up a whole lot of symptoms in one kind of convenient medication. And so it does quite a lot for mental health, for sleep, for aches and pains, often for your libido. It will do quite a lot of things for a lot of women, not to mention your hot flushes. But when we look at other treatments, they tend to focus on a particular symptom. So I think if we talk about hot flushes, there certainly are things that have been studied that some of them are quite surprising, like hypnosis, which I've always really thought was a bit of a crock, and I can't see the science behind it, and I can't really understand it. My science brain is just going, what? No. And yet the studies on hypnosis for hot flushes during menopause are fairly good.
So tell me, how does that work? Is it so many treatments, and are there particular kinds of therapists that specialise in it?
So I have to admit, my referral pad with the names and addresses of a range of excellent hypnotherapists is a little thin. So I'm going to have to say there's one that I refer to because I know she's got a particular interest in it, and particularly for women who, I guess when they come and see me, they kind of know what they're going to get in a way, which is probably a range of options around HRT. If that's what she wants, of course, it's always the patient's choice. But there are women who have gone through breast cancer, for example, and if you're one of the 50% of breast cancers that is estrogen receptor positive, that means that any additional estrogen in your body is like pouring oil on a grass fire. We cannot give estrogen, and that's the main ingredient of HRT, to any woman who's had an estrogen receptor positive breast cancer. Then we need to be looking at other alternatives, and hypnosis would be one of those alternatives. We have the other medications as well that do reasonably well.
Of alternative treatments, I'd be really interested in what you say are probably the top 4 or 5 that you think are really credible.
I think if it works for you and it is not dangerous, then I'm open to it. There are no really good trials that give high scores to anything. I think pine bark extract was sort of quite an interesting study, and I think if you wanted to give that a go, I'd be reasonably supportive. But I think that anything that you take can be good. The one caveat that I would say, so what I did with my book is I did allocate all of the alternative therapies, what I called a Gwyneth scale. And so 1 Gwyneth being looks okay, don't worry about it. 3 Gwyneths is, oh my goodness, head for the hills. This is a really big problem. I won't say why I named them Gwyneths, but anyway. So there are Gwyneths right through my book, and there are quite a few that I've awarded 3 Gwyneths to, mainly because they interact with other medications, have unacceptable side effects like things like putting up your blood pressure, which in a 50-year-old woman, you don't want to put up her blood pressure, particularly if she's putting on weight, for example. There are a range that I would steer clear of, and other than that, if you want to have some sage leaf tea, I wouldn't have a problem with that, even though the evidence is fairly pathetic. It's not a bad thing to take. There's nothing bad that's going to happen to you from having a sage leaf tea.
So tell me about the 3 Gwynnies.
So I've put heaps in here with 3 Gwyneths. Everything from flaxseed to Siberian rhubarb to Panax ginseng. There are a number of reasons. A lot of those ones interact with medications. They can cause leg swelling. A lot of them, if people have epilepsy, they do what we call lower the seizure threshold, so that it makes you more likely to have a fit. And with those ones that I've awarded 3 Gwyneths to, it's because the studies have been done and showed absolutely no benefit. So when you put together the theoretical, although they might not be common, potential side effects with the fact that we now have studies that say they absolutely do not work, they are ones that I would be quite concerned about. One of them that's really interesting is the wild yam cream, and most of my, I see a lot on Facebook.
Wild yam cream?
Yeah, well, yam contains diosgenin, which sort of stimulates the estrogen receptors, and it's very popular. I mean, you're not going to really go too far in an alternative medicine Facebook page without hitting up against wild yam cream. It's a real perennial favourite, but it's one of those ones where there's just simply no evidence that it does anything good whatsoever, and there can be some side effects. So they'd be the ones that I would stay clear of. But other than that, the vast majority, if you want to try them, I'm very supportive. And if you find relief from them, awesome, that's great.
Perimenopause can actually start in your 40s. Declining estrogen production during perimenopause brings on changes to menstrual cycles and often the onset of hot flushes, night sweats, mood swings, and sexual problems. Promensal Peri is specifically designed for perimenopausal women and can help relieve these common menopausal symptoms. Promensal Peri is available at leading pharmacies across Australia and offers a cost-effective treatment at under $1 a day. When things start to change, try Promensal Peri. Always read the label and follow the directions for use.
I want to come back to HRT for a minute because we've talked about the fact that the old school thinking about start taking it from 50 and have it for the rest of your life is no longer the case. So how long should you take it, and how do you know when to stop?
This is a question I get asked daily, and the reality is there's no answer that is the definitive on this date you stop. Despite what is still said by a lot of doctors, you can only take it for 5 years, then you need to stop. That's fairly old school thinking as well. So you would take it until you don't need it anymore. The thing is, how do you know you don't need it anymore? Because once you're on it, you're not getting any hot flushes anymore, or you're not getting any aches and pains anymore. So what I do normally say is it's completely up to you. And at some point, if you would like to try coming off it, I wouldn't jump off it. I would maybe, if you're on a patch, I'd cut the patch in half. If you're taking a gel and you're taking 2 pumps of the gel, I'd cut it down to 1 pump of the gel. And I would do that in like June or July. If we're listening in Australia, I would do it in winter, because in February, frankly, we're all menopausal and they're all having hot flushes regardless. Even if we're 20-year-old men, we're still having hot flushes. And it's really hard to tell how much is because it's just really ridiculously hot and how much it's because you've come off the HRT.
Yeah.
And then I would do it very slowly in consultation with your doctor. And, what's the worst that happens is you go, I've got to go back on it. We'll try it again in another year.
Sure. Is it expensive?
Some forms of it are super expensive. Yeah, they really are. But I think you get these, for many women, life is so unbearable and, they're ending up spending fortunes on fans and the air conditioning, the electricity bill is sort of going out of control and they're not being productive at work and they're risking, I'm not joking, they are risking their jobs and risking their marriages because they are in such a terrible state that a lot of them will go, I'm very happy to pay for this. But I think there is a case to be made at government level that the irrational fears about this stuff, treating it like heroin is probably not wise anymore and it should probably go back on the PBS where it belongs.
So looking at what it can address, obviously hot flushes is the number one thing that people think of. But what about things like vaginal dryness? What about libido? Things of that nature.
So let's talk about vaginal dryness first. It makes sense that given what turbocharges the cells of the vagina and the cervix to make the fluid that is the lubricating and self-cleaning fluid is a combination of estrogen and sugar in the cells, so that comes from the blood supply. You'd think that put a bit more estrogen into the body and it will work wonders. And to my surprise, and I'm not sure that we haven't just not done the studies properly, it doesn't seem to have that great an effect when you go on a patch or a tablet of HRT. And so as a result, I will usually offer my patients who do have concerns around vaginal dryness some estrogen directly into the vagina. And you can do that with or without HRT. And that tends to work really well. That's obviously not an option for women who've had breast cancer, and we need to talk about other things that we can do for them. And there are products that are available overseas that are not yet available here, but that will be here within the next few years that are looking at different hormones.
Let's talk about that estrogen gel. Can I buy that over the counter or do I have to ask my GP?
Yeah, so yes, I would say you need to ask your GP, but if you go online, you'll find advertisements for clinics where you don't need to see your GP. You can go to an online clinic and you have an interesting sort of consultation with some menopause clinics that are not supported by evidence, and you can be prescribed bioidentical hormones and you can be told that they are much safer, which they're not safer. They're still estrogen and progesterone. They're very popular. They're even more expensive than the stuff you can get from your GP or your gynecologist. So I would be careful about doing bioidentical hormones. Most menopause societies around the world are very strongly against those because they are compounded in individual pharmacy without the oversight of peak bodies like the Therapeutic Goods Administration.
So you don't really necessarily know what you're getting and it's not well supervised.
Correct. And some of them, I can tell you a list as long as my arms of my patients who've had them that have had terrible effects where they've been underdosed with progesterone and ended up with uterus problems. So yeah, it's not a risk-free event. But yes, if you want to have estrogen that I would say is reputable and is trustworthy, I would go to your doctor.
Okay, and now the other bit of that question, libido.
Yeah, so libido is a really interesting beast. So if you are feeling sad, tired, fat, sweaty and hot and unsupported by your husband who just thinks you're a moody whatever, then if you have a great libido, I am so impressed with you. Like, basically, we don't need to be having this conversation right now. That's amazing. But for most of us, that's a bit of a turn-off. And so putting someone on HRT, if they're no longer hot and sweaty, if they're able to get a decent sleep through the night because they're not having night sweats, if they're feeling less moody, if they're feeling less like they want to just cry all the time, if they're less itchy, then all of a sudden, just that alone might be enough. Then if we add in some vaginal estrogen and it doesn't hurt every time they have sex on top of it, then again, that might help us a little bit more. But that is not always enough, and we now know, so the International Menopause Society put out a paper earlier this year about testosterone for women who have meet 2 criteria. They need to have low testosterone on a blood test, and then they also need to have a hyposexual desire disorder, which is exactly what it sounds like you seriously don't want to have sex. And when you have those 2 things, you do qualify for having female-oriented testosterone, which is put on via the skin.
Okay, but that's not, and what do? You put that on every day, or or is it more like Viagra, like give me 2 hours?
No, I mean, there is that. I mean, you should probably read about that female Viagra, which is a very different thing. It was actually, that is one that you just have before sex. It doesn't, I actually thought it was pretty disappointing, the study.
Did you try
result.
it?
No, and no drug company ever sent it my way. I don't know if I would have. Like, it just sounded like you weren't doing that much better. It's not male Viagra. It's a completely different drug that works at the level of the brain. Well, it hasn't really taken off, and I'm not really surprised. I think the results were slightly short of stellar. But we certainly see reasonably good results from testosterone. But that's not to say that that's a one size fits all. You know, your most important thing is to get your self-esteem back, to work on getting enough sleep, to not feel hot and sweaty all the time, and to get your vagina back. Because if your vagina feels like you're having sandpaper covered baton rammed in there, nobody's going to really enjoy that. So we need to get your vagina back, and then once we've got all that sorted, we can sort out testosterone if you need it.
So Jenny, just in closing, if people are looking for expert advice, where can they find their Menopause Society?
The Australian Menopause Society actually has a section on their website, which is their Find a Doctor website. Having said all of that, I had a lot of people reach out to me on social media from, for example, the Northern Territory, where there were no members. So I think the Australian Menopause Society has not been active in recruiting people. So they wait for people to come to them and say, hey, I want to come and join the menopause crew. And that has left some women in certain parts of Australia really a bit worse off. And I've had people reach out to me to do phone consultations where there is no Medicare rebate. That's going to cost them quite a bit of money because they just simply cannot find a doctor in their own area. Having said all of that, for a lot of Australian women, particular women in centres, in urban centres and regional centres, there will usually be somebody who has an interest in menopause who can at least listen to you and support you in your choices, which is really what this is all about.
Fantastic. Thanks so much for your time today, Jenny. Thank you.
Thanks.
If you're interested in more advice from Dr. Jenny, do check out her great book, The M Word, published by Murdoch Books and available in all good bookstores. Our podcast today was produced by Lisa Gebelagen for Prevention Australia. If you like what you hear, make sure you subscribe to our podcast. For more information, visit our website preventionaus.com.au. That's preventionaus.com.au. See you next time.